afternoon, everybody. I'm Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County Government. With us today, Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment, and Elizabeth Holschuh, who is our Director of Epidemiology. We also have Doris, who is our ASL interpreter today. Thanks everyone for joining us. Dr. Ariola, do you have any updates on how this week's clinics are going?
Thank you, Jody, and good afternoon, everyone. The clinics are running very, very well. Yesterday, for our 9 to 7 clinic, we vaccinated 2,916 residents. That is out of the 3,000 that we plan to vaccinate. That is really the most that we have done in a day, and that's in people showing up for their appointments. And that's really good. The clinics is on right now, and I've checked a few times with staff. It's running pretty well. People are coming in. People are coming in not earlier than 10 minutes before their appointment time. Things are flowing steady. Really, really working very well. We expect the same tomorrow. So today and tomorrow, the plan is to vaccinate 3,000 residents each day. We're also vaccinating 1,100 residents on Saturday, and we've got a second dose clinic 9 to 1 on Friday, where we are vaccinating, I believe, about 1,100 residents. And so there might be a few second dose Moderna walked into some of those clinics also. And we just got off of a meeting with our hospitals, our health systems, and they are vaccinating also. They have appointments available, just like we do. We opened up a couple of days ago, 11,000 appointments for the next couple of weeks, the week of April 19 and the week of April 26, combined 11,000 appointments. I believe 6,500 of those are next week, and the following week will be 4,500 appointments. That includes appointments on Tuesday, Wednesday, Thursday, as well as Saturday. So talking with our health systems, I know what we are seeing. There's a huge amount of appointments that are available. It's a ton of opportunity for people to get vaccinated. A ton of opportunities to even select a date that works for you. We have 2 weeks open. It's the first time that we've opened that many appointments. We have done this weekly, but right now there are more vaccines coming into the county for people to get vaccinated. And the opportunity to get vaccinated is not impacted in any way by the Johnson & Johnson decision. No decision has been made, but we know that the advisory committee, ACIP that we call it for immunization practices, met today. I don't know whether the meeting is still going on, but there's a ton of conversations going on, looking at data. That's what science is about. After that, they are going to get to us in terms of recommendations on how to use the J&J. But for now, at our clinics, which really is no change, we've been giving out Pfizer and Moderna at our clinics, and that continues. We have been using J&J strategically. It's a tool that we love. It's a tool that we are hopeful will get back to us quicker. It's an effective and safe vaccine. And so once that's available, we'll continue to use that strategically like we've done. But our clinics this week and for the next few weeks are giving out Pfizer and Moderna. Lots of opportunities for you to get vaccinated. Just go to our website, book an appointment, and get vaccinated.
I'll go ahead and jump into, as Dr. Ariola said, there are a number of vaccine appointments available. And I think we've really started seeing a shift from really all the individuals who were very excited about getting the vaccine at the beginning, when we had too few doses available and too many people who wanted it. And we're starting to see this shift where both Johnson County as well as our partners have more vaccine appointments available than seemingly people who want them. And so it really comes down to us as residents, as community members, to talk to our friends and family about the vaccine. If you've received it, and you have people in your circle who are hesitant to do it, I think it's really important that you talk to them about why you yourself chose to get it. Certainly not shaming individuals. Getting a vaccine is a very personal choice. But talk about what the importance was for you as a person. Was it because you interact with people who are high risk? Is it because you yourself are high risk? Was it because you know how important it is for the community and for our healthcare system that as many of us are protected as possible so that we don't overwhelm our healthcare system, which we are seeing in other parts of the country right now, even as vaccine uptake is increasing? Is it, quite frankly, my mother honestly is fairly anti-vaccine and for a long time wasn't planning on taking the vaccine. And for her, the impetus was because she wanted to travel and travel internationally. And she knew that that would make it easier for her. Also myself, I have a fear of my child infecting my parents or my in-laws who are older. And so I was concerned about their safety and being around my child. And so, all of those reasons, the reasons why people either get vaccinated or don't get vaccinated are very personal. And so by really just having a conversation where you're not judging the other individual for their choice, but really trying to understand and just share, I think that can be really helpful for people to talk through what their concerns are. And certainly if you are somebody who isn't sure if you want to get vaccinated, reach out to your physician and have that conversation with them. The doctors are incredibly knowledgeable, and I can certainly understand why people would rather talk to their primary care physician than hearing from, the government officials who are telling you to get vaccinated. But this is really the moment for us to continue to come together as a community to ensure that we continue to vaccinate as many community members as we can, because it's not until we have a large percentage of our community protected through vaccination primarily that we're going to be able to prevent COVID-19 from transmitting through our community and also impacting our healthcare systems. Like I said, we're seeing it in Michigan now. I believe I heard today, had a 635% increase. I don't know if that was in hospitalizations or cases in the span of 1 week. And that's really the thing about COVID-19 in particular with these new variants. The trajectory can change very, very quickly in our communities. And we're starting to see a little uptick in our case counts. We've really been hovering around 73 to 75 cases per 100,000 for really the last probably 5 or 6 weeks. And this week, we're starting to see that tick up a little bit. We've made tremendous gains as a community by doing all the things, by wearing our masks, by staying physically distanced, by not gathering with people outside our houses, and now by vaccinating. But these gains can be lost very quickly. And all we have to do is look to other parts of the country to see that. So have conversations with your friends and family. It's not quite time to let down our guard. As I said, especially with this slight uptick and something we'll be watching. Last week was our highest case count in about the last 6 weeks. So we all need to continue to do all the things that we can and to bring our community along with us, because we are in this as a society, as Johnson County. That's what it's going to take. And that's what it's taken to get us to this point so far.
And I know typically, I believe on Wednesdays, we get new updates on some of our data. Do we have new numbers yet on number of Johnson County residents who have been vaccinated?
We do, in fact. So we got that report earlier today, and it looks like in the last week, we've added an additional 31,000 vaccinations overall. That includes an additional about 13,500 first doses and about 18,000 individuals who are fully immunized now. And what that brings us to, if you look at our total population, it's about 3 in 10 of our residents are fully vaccinated. And if you look at just our eligible populations, those 16 and up, that's about 4 in 10 have at least 1 dose. And when we look at those who are fully immunized, so completely protected, we're only looking at about 2 out of 10, 20% of our full population, and about 25%, or 1 in 4 residents who are eligible are fully vaccinated. So we are making progress, but I think certainly there's a concern both among us at the health department as well as our healthcare systems as we're starting to see this plateau or really decline in demand, especially right at this moment where we're getting all these vaccine appointments. And so now is the time really for us to come together as a community and really try and keep working towards that finish line of getting a large enough population vaccinated.
And across the country, and local hospitals also are beginning to see an uptick in hospitalizations, albeit occurring in younger population, mostly yet to be vaccinated persons. There's a few breakthrough infections here and there, but most of them are occurring in people that are yet to be vaccinated. Again, very important that the vaccine is a very good tool, really unusual to be 1 year into a pandemic and have choices of vaccines available. it's now our responsibility in addition to the privilege of having that, it's our responsibility to get ourselves vaccinated. And so the opportunity is there, and we are going to continue to work with our community partners. It's not just us. So there are companies that are vaccinating their employees. That's ongoing. Our health systems are vaccinating. Pharmacists are vaccinating. Now we are pushing vaccines to private providers, private practitioners out there. So multiple opportunities, and you will see that in our numbers coming out. Again, I do note that the CDC, Centers for Disease Control and Prevention, is showing number fully vaccinated slightly higher than what we are showing. They have a broader view, and so we also take those numbers into consideration. They are not reporting first doses, but so if you see those numbers, that probably includes some of our residents that were vaccinated in other states. We're not currently getting those data, but based on those that are eligible 16 plus, 40% of our population we know has been vaccinated. We also know that there's a lag in data reporting. We know that from our own facilities, we're still entering data from last week. It doesn't include data from this week. So chances are that we're slightly higher than that. And so our projection of getting to vaccinating at least 50% of our eligible population by the end of April remains. But the key variable there is if people show up to be vaccinated in the next couple of weeks. That's the key thing. The appointments are there. That's our goal. Let's get there together. Book an appointment, get vaccinated.
And I know you've spoken before about certain companies or workplaces that have done vaccination clinics for their employees. If somebody works for a business that they think we might be a good one, can they ask their HR department, or what would you say if somebody's interested in looking into like a workplace clinic?
So there are multiple opportunities. Obviously, yes, you can talk to your HR. You can clearly come to our clinics. We have a ton of appointments. You can go to pharmacies and any of the health systems, they'll vaccinate you. But if you're a large employer and you want this to be minimally disruptive and you want to bring the vaccine into your establishment to vaccinate your employees, we have done that too. So you can reach out to us, give us a call, send us an email, jcdha@jocogov.org, or call us 913-715-2819, and we'll be able to. We'll be very happy to work with you and walk you through the process. Typically, it does involve collaboration with a pharmacy group because we are spread very thin. But give us a call. We'll walk you through how we can make that happen.
Yeah, and I mean, I got an email just today, actually, that my child's daycare has a clinic set up tomorrow with in partnership with CVS for all of the families of kids who attend that daycare. And so I thought that was a really great partnership, and it's very exciting to see. Now that we've gotten the staff vaccinated, they're allowing staff's family to come in and the children's families to come in to get vaccinated at a really easy location. And I think that's definitely some of the move we'll be seeing as we try and continue to get vaccines available to people in public health. We always say to make the healthy choice the easy choice, whether that's about sidewalks or healthy food. The same sort of goes for vaccines. We have to make the vaccine choice the easy choice where people are gathering and people are located. So, as we move forward, we'll be working on all these different strategies to ensure there's multiple opportunities at multiple locations for vaccine uptake. And we're going to see that too with some of our school districts, where the work plans are still in the works, but it looks like one of our school districts will be vaccinating their 16 to 18-year-old students within the school hours at the school buildings, whereas another school district has opted to move forward and have a clinic on a Saturday where they will not only have their 16 to 18-year-old students, but also their families come in. And we'll be continuing to work with the school districts to offer vaccines through them for their families, because sometimes it's the schools that are the trusted voice in their community as opposed to, the county. So, we're definitely doing what we can to try to get the vaccine out into locations where it's easily accessible for residents, whether that's a primary care provider, a school, a workplace. And so stay tuned for additional opportunities. And absolutely, if you maybe run or in an HR or, are interested and you talk to somebody, jcdhe@jocogov.org. reach out and we'll see what we can do.
Great, thank you. We have a couple questions on Facebook. Somebody is asking, what is the difference between the WebIZ data and the Insight data on the vaccine distribution page on the Johnson County website?
One excellent question. So Insight is our electronic health record that the county health department uses. So what that reflects are vaccines that the department has given themselves through our vaccine clinics, any of those times where we are the provider. So any of our public clinics, that's where those numbers are going to come from. The WebIZ is an online immunization information system, as they call it, and that is Kansas's system. So all Kansas providers are required to report the vaccines that they have provided into the system. And so that's a more global view of all Johnson County residents who are vaccinated anywhere in Kansas. So just to be clear, the numbers from WebIZ include the numbers in Insight. Those are not two separate sort of pieces. But as Dr. Ariola was mentioning, it does not include people who were vaccinated, say, in Missouri, which we know is a really big gap because we live on a state line and we know that residents have gone over to pharmacies over in Missouri to get vaccinated. So we're working, and Missouri has what they call Show Me Vax. It's their version of WebIZ. That is their immunization information system. And so we're working to see whether or not we can obtain that data directly from them. So unfortunately, we see this a lot where just all of the data systems are very separated and they don't talk to each other. And it's definitely a hindrance in these moments where we really do need to see that global view. So we're working as hard as we can to try and get this information, but that's where those two different numbers come from, our Johnson County Department of Health and Environment's administration of vaccine versus all Johnson County residents who are vaccinated in the state of Kansas.
And we have a question while we're on this topic from somebody asking about how many residents are fully vaccinated as of today. I was going to go ahead and share my screen because it looks like the website has been updated with that data. If you maybe want to talk through those numbers, Elizabeth.
Absolutely. So we update the top number, so that Johnson County number from WebIZ once a week on Wednesdays, usually by about 3:30 in the afternoon. Those numbers do get updated. And so we have had 187,000 first doses administered and 115,000 second doses administered for a total of 303,000. So the one thing that, as I'm looking at this, we'll continue to work on is now that Johnson & Johnson at least was available in our community, some of those first dose people are actually fully immunized because Johnson & Johnson only requires one dose. So those are a little different than some of the numbers I just provided to you, but that's where that comes from. And so KDHE provides this data for us once a week.
And for that question about WebIZ and Insight, you can see here when we say what the source is, SRC is just a abbreviation for source. WebIZ is up here and Insight is right there. So I just thought since there were some questions there, I'd go ahead and show that.
And that is on our website.
Yes. What happens if there continues to be numerous open appointments and less than 50% of the population is vaccinated?
Well, so we knew starting this process that there would be at least three different groups. There are those that would take the vaccine immediately, and there will be those that will be a little bit hesitant, but eventually will, and there will be a small percentage that will not. And so it just means that for us, we will continue to adjust our tactics. It might be that we no longer have a need for a lot of mass vaccination clinics. Rather, we need to do more targeted, focused, small vaccination clinics where we take vaccines to people to make it convenient for them. A lot of educational piece. Again, to be clear, the further away that we are from herd immunity. Now, 50%, to be clear, is not population immunity. That's a local goal that we set during the conversation around the latest public health order. I want that to be very clear. So 50% is not our goal. That is not sufficient to get us to where we need to be. Obviously, the further away from herd immunity that we are as a community, the longer that other factors are going to become necessary. And the higher the risk will continue to be. The virus is here. So the virus is going to be circulating, And if we are not getting more than 50% of our population vaccinated, it means that those that are not vaccinated the virus is going to continue to circulate, and there will be breakthrough infections even in people that we have vaccinated. So that our job is to lay those factors very clear to the community, and we'll continue to do that. It is our hope, though, that will make getting the vaccine easier for people. Maybe we don't need 9 to 7 clinics. That's fine. Maybe we need to take vaccines to churches. Maybe we need to take vaccines to workplaces. Anything we can do to make it accessible to people. We clearly will put ourselves in positions to continue to answer people's questions. But again, 50% is not our goal. It is strictly something that we targeted based on the latest public health order. It is insufficient to get us to where we need to be. If we have 50% of eligible population, not even our population, if people are going around and they are not vaccinated, we're giving the virus opportunity to circulate. We're giving the virus opportunity to mutate, and there will be variants that will be more infectious and potentially less susceptible to the vaccine that we have. So we need to understand the risks that are associated with these things. For our efforts to be successful to keep the virus suppressed, we need a lot more of our population to get vaccinated. The good news is the efforts that we are having to vaccinate 16 to 18-year-old, and the news that potentially at least the Pfizer vaccine might be approved very soon to vaccinate even younger population. We need all of those things. We need a lot more of our population to get vaccinated. We are not new to the public health industry is not new to vaccine and controlling diseases with vaccine. In all of those cases, when you vaccinate enough people, it's easier to control sporadic outbreaks. But if you're at 50%, the outbreaks are not going to be sporadic. The virus will still be around a lot more than we want it to be, and we don't want that.
We have another question. If all of the vaccines are the same, why were they not all put on pause?
The vaccines are not the same. So the J&J is the carrier is an adenovirus, but it's an adenovirus that is known to not cause harm in humans. Okay, so what that does is really a vehicle to introduce the part of the DNA that codes for the spike protein. We talk about this spike protein all the time. Okay, so in basic biology, for those that remembers that, you know that we've got the transcription and then translation. So DNA would through the process of transcription would produce the messenger RNA, the mRNA, and then that translates to the protein. And so the body recognizes that protein and sees, oh, there's a foreign material there, and elicits the immune response. The technology for by the way, the adenovirus vehicle is also the same vehicle that was used to develop the Ebola vaccine recently. And so to keep that in mind, and some of these reactions that we're talking about have not been seen in those. I would say that we're very early in the investigation to make overly conclusive inferences about this. We're talking about 6 cases out of 6.8 million. So the condition itself, the blood clot, which is rare, co-occurring with the low platelet, that by itself, let's see how many cases we have out there. Let's see if there are additional precautions that will allow your doctor to recognize that, take your vaccination history into consideration and manage that better. That's the way to look at it. Now, we haven't seen them in the mRNA vaccines of Pfizer and Moderna, and so there's no need to generalize. But again, there's a lot that we don't know about the J&J and the relationship with this relatively rare condition. So I would say let's not jump into conclusion, but we don't universally take everything out of the market because we see a potential concerning one.
And part of this is that there's a vaccine adverse event reporting system, or VAERS, and we've talked about that before on these Facebook Lives. And what VAERS is a way for providers, for individuals, you as yourself can get on and report an adverse event. And that's a way that the federal government, FDA and CDC, look at any kind of adverse event or reaction following a vaccine. And so I think what's really important when we think about this, in public health, we often say temporality does not equal causality. So that means that just because something happened right after another does not mean that it was necessarily caused by that. So sort of the way you can look at this is like, I ate tofu for the very first time, and then I got in my car and had a car accident. My eating tofu for the first time did not actually cause my car accident. They just happened to occur together. And so when these reports are provided by physicians, vaccine providers, by individuals, we don't necessarily know if that event was actually caused by the vaccine or just happened to occur at that same time or within a certain time frame. But this system is set up in place so that we can detect these really rare events. So 6 people out of almost 7 million doses is a very rare event. And so this is how vaccine rollout works. Vaccinating 7 million people is far more than we ever do during clinical trials. And so when we see these rare events, and we can't yet say whether or not they are or are not associated with the vaccine, we're going to take a pause. The federal government will take a pause and we'll start looking into that. They will look into these individuals' medical histories, the timing between their vaccine and when they had that blood clot issue, their health record after they had that. And they'll look at all of these different pieces and then make a decision as to whether or not the vaccine actually did cause that event. And if that is the case, if that's what they determine, then we'll see some changes in recommendations. And again, we saw this exact same thing happen in the European Union around Astrazeneca, which is another vaccine that we don't have licensed here in the United States, where they also saw blood clots. And so they did a pause in the EU. They looked at the data. And now they have some additional recommendations that women under the age of 50 should not receive AstraZeneca, I believe is their current recommendation, because those women are at an increased risk for blood clots. And so, this is part of the evolution of vaccine rollout. And unfortunately, it does happen just because when it's something that is so rare, like 1 out of 1 million, we just don't have the ability to see that before it goes onto the market. So this is completely what should happen. I think that it is evidence that our system works, that 6 events can cause an entire country to say, hold on, let's just make sure. And so at this point, they have not been able to identify any other rare events that have occurred with Moderna or Pfizer, those other 2 vaccines that we have licensed right now. So that's why those 2 vaccines are continuing to be used, because they haven't identified any issues with those 2, but have with the J&J.
And the pause in the J&J, again, just to summarize what we are saying, is out of an abundance of caution. Okay, for us, that is the consideration of scientific plausibility. That is, you've got to be able to really get into associating taking the vaccine with this. We don't know enough about how that happens, whether that's, and so again, out of abundance of caution, personally, I expect that to be back maybe with an additional recommendation to be careful, to be able to track those, but also for medical providers to know how to manage those. It's a good vaccine. It's an effective vaccine, and we hope that it's available as a tool for us in the coming days and weeks.
Thank you both for sharing such great information and answering some questions on Facebook. I appreciate that. Dr. Sami Ariola, Elizabeth Holshoe, thanks so much for being with us. Doris, thanks for being our ASL interpreter. We appreciate you on Facebook who are watching and engaged on this topic and asking questions. Thanks so much, everybody, and have a great rest of your day.